definitely can say that over the last 9-10 years, sort of working not in the strictly addictions realm, but encompassing areas, it's come a very long way. I am happy to say that the sort of context that I was first brought into the realm of addictions, homelessness, mental health was in part a harm reduction approach, working in injection sites and injection sites, homeless shelters, that gave me a lot of opportunity for not these sort of large events, but the micro sort of transactions that occur over time, and getting to know the sort of people behind the story, and having the time to really spend time with folks. I think having done that, working a lot in the community prior to coming into a hospital setting, was having to be very present and focused, and having these direct interactions where folks do pass away, and having, the reactions that come from that, and very large aha moment, and that it really does make you question and think a lot about, what values and where you come from, and especially to the sort of reactions and how that might change how you see things. Person-centered care, as it sounds very basic, but it goes a very long way in terms of how to sort of meet where that person is and what they want to be essentially achieving or striving for, but also sort of balancing the idea of risks and harms that this person would expose themselves to in this sort of context. It's hugely important because I think that was something that was not a big focus for a very long time, and I think we saw multiple, even in today's sort of society, like what's happened because of that, and not working with individuals and having these sort of forced and coerced sort of methods of treatment and health provision. I think the best way to have success is, even if it's not necessarily striving towards the greatest sort of health outcomes that one may think of, but sort of working towards that eventuality, that, you work, it's not going to happen overnight, but it can happen, and it's very much sort of left to the patient that you're working with to kind of have those moments of finding that themselves, while having sort of good supports to help not necessarily influence them, but support them on that way, and the basics around like education and advocacy just to help getting there. And I think the big thing too is to sort of separate empathy from sympathy. That feels very much like a staged approach of how one would see each other. I think the basic and the best thing to say about empathy is in sort of not these, we get so bogged up in these sort of major interactions where we have case conferences for folks, and we have these lengthy consult interviews to capture as much information as possible. But, in the few moments you see them, where it's not like you are speaking to them for 20-30 minutes, but just in the one-off interactions where, basic empathy goes a very long way, and sort of establishing the trust and rapport one would hope for out of sort of a health professional, and again, sort of starting that path towards what would be the best health outcome for that person. Unfortunately, I think, I know there's lots to be said in regards to time and resources, but it's important to try to reorient yourself to the present moment as much as possible, and to really value those brief moments that you might have with somebody. You see so many people a day. It's important to not paint with a wide brush. The idea that you take each person individually, and each person will have a story. They may blend together in the idea that they will be similar, but each person has a very individualized sort of story to them. It goes back to that authenticity piece, just being as authentic as possible. Again, both in those sort of longer interactions, but the short ones as well, where you don't obviously be professional, but the idea that you can, relate on different levels and get to know the person a little bit deeper than just the patient that's kind of on your roster at the time. I'm very lucky to have had the opportunity to do both, make the transition from community agencies to working in a hospital setting, because communication is huge. A lot can be done in a hospital for a very important acute health sort of intervention, but the majority of the work is going to be done out in the community. Working with main teams and those who are really more the decision makers in regards to how someone's treatment may look as they kind of progress through a hospital admission or a presentation. It's a good time for collaboration. Making sure that, again, the idea of patient-centered care is respected, and understanding that priorities may not align with what we would hope them to be with somebody. Hugely important is the sort of collaboration that's done into the community as well. Again, having had the opportunity to do both. There can be a large disconnect at times, and it's sometimes as simple as obviously, talking with that person and getting the permissions and the contacts and sort of the background information, but being able just to say, is there anyone trusted that you want me to let know about this? And, that's a really good opportunity for where, if there's something that started, if something is ongoing with them, what can I do in the, brief to medium brief timeline that I have with somebody to help achieve those goals that are already started. And at the same time, making good connections and trying to be as trustworthy and, compassionate face as possible for folks to have in the department, emergency department, and sort of the hospital wider. Yeah, I think, and unfortunately it goes a lot back to the conversation around resources and time, but at least personally, it is to have the time to be able to break down interactions that you might have had and, be able to meaningfully pay attention to what kind of reactions and sort of emotions that might arise from these sort of times and conversations that you have with somebody. It's, silly to think that we don't have those sort of implicit biases that might interact with how we go about our day to day. And it's important to be able to meet them and speak to them and see if that was the most appropriate or the most sort of patient-centered approach. I think there's a long way has come in regards to being able to name the stigma around folks who suffer from addictions and sort of substance abuse related issues, hospital and community at large. I like to say that there's been a lot of attention and time paid and in hospital, that it is a issue that everyone knows about, not just the select few. And again, it's those micro interactions, not with the patient themselves, but with your colleagues as well, to be able to break down situations that you might flag as have been something to talk about. Trying to model as much as possible for folks, getting to work with a great sort of waves of students in various sort of disciplines, as well as having the multi-professional team approach and being able to work with them sometimes very closely. For education for myself and education for them too. Goes back to just trying to model as best as possible and also having the time for myself to address my own kind of issues and thoughts that might come up. Guilt and shame get you nowhere. It's not wasted, but it's emotions and feelings and energy that can be shaped into something that will be a lot more productive for folks. So again, going back to the knowledge and the sort of basic assumption that everyone carries these things, and it's not necessarily productive or fair to be punitive to folks around it, but also trying to elicit what their thoughts were in leading up to that in that moment. And we can talk about calling in and calling out and having those opportunities to really address and directly address those things. But I think also coming from the basics that we are, people come from a good place. I don't necessarily believe people are coming in sort of to negatively impact somebody, but just how to best maybe change your approach when you come into different sort of situations, and utilizing that energy of coming from a helpful place, and sort of how that might look different. It's huge. It's funny. It kind of speaks to an example that is very top of mind. I think a great learning opportunity was somebody in our emerge department who needed and were on medication in terms of cardiovascular health. They were homeless at the time, and I think if I remember correctly, the sort of circumstancing leading up to that presentation prior to that was that their tent had been essentially ransacked and ran through, and everything was gone. And I remember a young doctor saying, make sure to take your medication, keep it in a safe spot, and the person saying, I can't even brush my teeth or get to the bathroom sometimes. Like, how am I supposed to be able to do that? Understanding that there's so many factors that we don't get to necessarily directly impact that shape the person that you see in front of you on whatever given day. We can also speak to the sort of interactions I have in terms of like comorbid health issues, whether that be psychiatric or more physical sort of in nature. But knowing that there's a lot of things that impact care, and the understanding that the hospital is going to hopefully be just a brief stop for that person on their journey of their life and wellness, and how best to understand these social factors that these people are experiencing, and unfortunately a lot of the time negatively really impacting them, and how best to take care of themselves, how that will impact that person's treatment going forward out of the hospital, and importance in terms of being able to plan for effectively. Just because, sometimes the lifestyles that these folks unfortunately are subjected to are not conducive of health and wellness, and how can we do best to, again, reduce that harm and sort of have the best health outcomes for somebody. I think I would have to go back to those sort of the transactions you have that very briefly that go a very long way. It might be sort of a quick interaction on my end, and one that I have over and over and over again with folks as I just go about my day and work week. But to somebody who is in the hospital for sometimes very serious reasons, this is something that really stands out to them. And a lot of times too, in a position of vulnerability that they might have, especially sort of when they have a health issue and why they're in a healthcare setting in the first place. It goes a long way in terms of being able to achieve good health outcomes and what we would hope to see in a healthcare setting to best help this person. Going back again to time and resources, kindness is something that has no dollar value attached to it. It's really more so in terms of the time that you can give somebody, and being authentic and compassionate and empathetic to that person and the situation that they're going through.